Dear esteemed chairs, dear colleagues, dear audience, welcome to my 12 months progress report presentation. My PhD topic is about key differences in sex-specific outcomes after anterior cruciate ligament reconstruction. My name is Krisztina Kornis. I'm a physical therapist and a first-year PhD student. I started my PhD with a clear vision, which is to revolutionize physical therapy assessment and treatment with innovative methods, and my mission to achieve it is to explore innovative strategies in physical therapy by conducting research. I have two ongoing projects at the moment. Both of them are investigating the effect of sex on the outcome of anterior cruciate ligament reconstruction surgery, with a particular focus on graft tear and arthrofibrosis. I would like to introduce you my first project, a systematic review and meta-analysis, which is investigating the effect of sex on the outcome of anterior cruciate ligament reconstruction surgery. Anterior cruciate ligament is a double-bundle dynamic ligament which maintains the knee stability in dynamic movements. Only in the United States, there are more than 100,000 ACL reconstruction surgeries every year, and we know that the incidence of a second ACL injury in athletes after ACL reconstruction is nearly 6 times higher than in the healthy controls. Despite the high prevalence, I investigated the literature and realized that different sources publish different results. Some articles mention that both sexes have a similar chance of experiencing a second ACL injury, while some others mention that females have a higher rate of secondary ACL injury, and some papers publish that males have a trend towards higher re-injury rates. We also know it from the literature that some anatomical differences, hormonal effects, biomechanical factors, and variations in the neuromuscular control can influence the success rate of ACL rehabilitation between the sexes. But the question is, what are these differences and what are these effects exactly? In this slide, we can see the quadriceps angle and the dynamic knee valgus. Quadriceps angle plays an important role in knee biomechanics. Due to anatomical reasons, females have a higher quadriceps angle than males, and one of the most common altered movement pattern is dynamic knee valgus, which is often associated with a higher quadriceps angle, which can increase the risk of non-contact ACL injuries in female athletes. We also know from the literature that higher estrogen level can increase the risk of ACL injury due to the hormone's effect on laxity and neuromuscular control. There is a need to recognize the different factors that can influence the success rate of reconstruction, and my aim is to identify if there is a difference in the clinical outcome after ACL reconstruction between males and females. My clinical question is if there is a difference between males and females in the clinical outcomes after anterior cruciate ligament reconstruction. I aim to investigate patients who had undergone ACL reconstruction surgery and completed rehabilitation. I compare females to males, and I identify two outcomes. The first one stands for the graft failure outcome, like revision surgery or return to sport failure, while my second outcome summarizes the knee instability outcomes. I hypothesize that females have worse clinical outcomes after ACL reconstruction compared to males, and if we can prove this hypothesis is true, we can immediately start developing sex-specific protocols for rehabilitation plans, which may enhance the success rate of ACL reconstruction. We identified 4 domains. The first and the second stands for the ACL and the surgery. The third one summarizes the outcomes, and the fourth one stands for the sex differences. The search was conducted in 3 databases. We initially identified over 11,000 records. After screening, 35 articles met our criteria, with an additional 8 studies included through Citation Chaser. This slide summarizes our outcome measures and analysis status. Ongoing analyses include IKDC, KOOS, Lish-Holmes score, and abnormal laxity, all to be completed by September the 5th. Completed analyses include graft tear, a key indicator of graft survival, and return to sport, an essential patient-centered outcome. Together, this structure helps us keep track of where we stand in the project and ensures that each outcome is addressed in the planned timeline. Here we can see the result of graft tear visualized in a forest plot. Graft tear is one of the most important outcomes after anterior cruciate ligament reconstruction, as it is the most obvious indicator of graft failure, which if happens, it can lead to instability, inability to return to sport, reduced quality of life, pain, and the need for revision surgery. Here we have graft tear measured in event rates compared females versus males. The analysis includes 26 studies with nearly 11,000 patients. Study types are mixed. Most of them are retrospective cohorts, but some randomized controlled trials are also included. Heterogeneity is 60%, which is considered moderately high. The reason of that is probably that we pulled together athletes and patients from the general population, as well as different age groups above 18 years. We calculated odds ratio. The odds ratio below 1 indicates a higher odds of graft tear among males, while odds ratio above 1 means the same for females. Our pooled odds ratio is 0.9, suggesting a 10% higher odds for graft tear in males. This result is neither clinically relevant nor statistically significant. On figure 2, we can see the pooled analysis of return to sport after anterior cruciate ligament reconstruction. Here we also compared females to males. This outcome is highly relevant, as return to sport is one of the primary goals of athletes after anterior cruciate ligament reconstruction, and also it is a major determinant of patient satisfaction. This analysis includes 5 studies with more than 1,500 patients. Follow-up times range between 2 and 8 years, and the study types are mixed. Mostly cohort studies are included. The heterogeneity is high, which is likely due to different definition of return to sports or different graft types and different sport activities among the participants. The pooled odds ratio is 1.36, indicating that females had a higher chance of returning to sport compared to males. This result is neither clinically relevant nor statistically significant. However, it is important to use clearer definitions of return to sport failure in future research, since there is likely a difference between an athlete being able to return to their pre-injury level of sport versus continuing their career at a lower level. In addition, exploring the reasons behind these decisions is also an essential factor. The project passed the feasibility check. The Prospero was submitted at the end of November. The duplication removal, the title abstract screening, and the full text selection was completed. The data extraction is also ready. The risk of bias assessment is completed, and currently we are working on the figures and the manuscript. My second project is about investigating the effect of sex on the prevalence of arthrofibrosis after anterior cruciate ligament reconstruction surgery. This is also a systematic review and meta-analysis. Arthrofibrosis is an abnormal fibrotic response which can lead to excessive scar tissue formation in the joint. The most common complaints are pain and limited range of motion. The incidence of arthrofibrosis is between 1 and 12% after ACL reconstruction in the United States. While the majority of the patients can be treated with non-surgical management like physical therapy and mobilization, around 4% of the patients need additional surgery like scar tissue removal or even revision surgery. Arthrofibrosis can significantly impair the functional outcomes and may prolong the rehabilitation, and my aim is to identify if there is a difference in the prevalence of arthrofibrosis after ACL reconstruction surgery between males and females. My clinical question is if there is a difference between males and females in the prevalence of arthrofibrosis after anterior cruciate ligament reconstruction surgery. I aim to investigate patients who had undergone ACL reconstruction surgery and rehabilitation. I compare males to females, and the outcome is arthrofibrosis or revision surgery due to stiffness. I hypothesize that arthrofibrosis is more common in females than males after ACL reconstruction surgery. Why is it important? Because by understanding sex-specific risk factors for arthrofibrosis, we can guide the development of rehabilitation programs that are optimized for men and women. Here is my preliminary search key. The search was conducted in 3 databases and led me to my key articles. One of the most important aspects for us was to find articles which provide separate sex-specific results for males and females. I would like to highlight that currently there are very limited sex-specific protocols for musculoskeletal conditions, surgeries, and rehabilitations, and with my projects I aim to address this gap. I believe that in some aspects we all have to be a little bit innovators in our fields. Therefore, I would like to thank you for your kind attentions with one of my favorite quotes: "Do not follow where the path may lead, go instead where there is no path and leave a trail." Thank you for your attention.